And now we're going to invite up Dr. Femida Kherani to talk about the Canadian Ophthalmic Practitioner Ergonomic Survey, or the COPE survey.
Thank you very much. So we thought it was a cute name because we wanted to learn how to cope with our pain. So this was initiated by myself and Amin Kherani. Dr. Bellin was advising us all the way through, and Emmy Saunders, who is our research assistant in Calgary. I do have some disclosures as I'm a speaker, but none of them are relevant to today's topic. The Canadian Ophthalmic Practitioner Ergonomic COPE study was a study to evaluate the ergonomics and workplace musculoskeletal discomfort, but it includes the whole team. So it includes ophthalmologists, residents, fellows, assistants, technicians, nurses, and orthoptists. It was approved by the IRB at University of Calgary, and it was a 25-question survey which you received through the COS listserv, which included the surgeons, the residents, and fellows, the COC, which is the Canadian Orthoptic Council, and the JCAPO listserv, which included the Canadian technicians. There is a large overlap in all those listservs, and the email was initially sent in May and then collected just until Monday. So who completed the survey? 317 completed the survey, and we did have about 142 physicians and 174 allied health professionals. The average age was 49 and a half physicians, 43 allied health professionals. There was a male, female, there were greater males than females physicians, and of course there was a large female predominance in the allied health professionals, which just reflects our membership. The average years in practice was 19 for the physician and about 16 for the allied health professionals. And the average number of hours working per week was 46 for the physicians and 36 for the allied health professionals. So we also asked a specific question: has the EMR implementation affected your musculoskeletal discomfort? So although our initial response was 271, when you take out the ones that don't actually have an EMR or use an EMR, then our survey showed that we actually had increased discomfort with EMR in 35.4% of all people. And when you actually look at it further, what that data is telling us, the bottom line is that only 23% of people had no workplace discomfort with their EMR, only 23%. That means that almost 80% have workplace discomfort with the EMR implementation. That means 3 out of 4 people in this room probably have some discomfort. And where does it hurt? So our study showed that it hurts in the back, and we actually subdivided it into upper, mid, and lower, but overall in the back and in the neck, shoulder, and upper extremity. So has EMR added workplace challenges? Definitely. 61% overall said so. 70% of physicians found it harder than 55% of allied health professionals. And have you implemented any ergonomic considerations in your clinic? 71% of physicians actually have, and 65% of allied health professionals have. Have they been implemented in the operating room? Yes, 78% of physicians and 30% of allied health professionals. And were they implemented in the administration area? 71% of physicians said yes, 65% of allied health professionals said yes. So what were the top things that were implemented by physicians in the clinic? Number 1, posture changes. Number 2, exam lane setup. This is really important, right? If we're not aligned in our examination, then all day long we are twisting unnecessarily. Patient chair modifications, 23%. What were the top ergonomic changes made in the operating room by physicians? Table height, 82%. Patient position, 71%. And postural modification, 60%. What top ergonomic changes were made by physicians and allied health for administrative duties? Postural changes, 68%, office setup, 35%, and monitor adjustments, Just a simple monitor adjustment can help you, 29%. What top ergonomic changes were made by allied health only? Postural changes again, 60%. Exam lane setup, 36%. And then again, the patient chair modifications, 32%. So 71% of physicians and 65% of allied health professionals are already making changes. But we are all still having discomfort, which lends us to that exact question that you asked, is the equipment is causing a lot of our challenges. In the operating room, we're almost 80% of physicians, 4 out of 5 physicians are already implementing, making those changes, and we're still having trouble. In administration, 50% of physicians are making ergonomic changes. So what are the challenges, which we've all reviewed clearly? Position of the keyboard, computer to the patient, the location, the turn, the twist, performing the examination, attention to the patient. How do you look at the patient and still do your typing? One idea that was expressed in the survey is that there's no time to address the ergonomics because we're so busy. But unfortunately, if we don't make the time, then we're going to be compromised. Increased sitting and increased time in front of computers, using the computer mouse. People have found some irritation and pain just with clicking, and they complained about it, and that was reported in our survey. We have challenges in ophthalmology that are inherent to our equipment. The use of our loops, the use of our lasers, the slit lamp design, the direct and indirect ophthalmoscopes, the equipment weight. Even when we were doing and talking about DCRs yesterday in our oculoplastics meeting, we were talking about the weight of using a drill, using a DCR drill, and the sonopet, even the newer technology, trying to find the lightest weight, and of course, trying to make everything wireless. So what do we need to change? And I think this is why we're so happy that all of you are here today, is because we want to talk about how we as a group can lobby for better design, better chairs, better clinic exam layout. Perhaps our stands could be better made, make it easier for us. And again, the weights of indirect ophthalmoscopes and lasers. This is actually one of our national Heine reps, and she's trying to make sure that I'm actually wearing it right in my clinic. And of course, EMRs as well. We have to make sure that we have appropriate screen sizes, monitor sizes, and that they're aligned at our eye level so that we can optimize our ergonomics. Most of all, we need to improve our workplace culture. We have to have a forum where we can talk about it openly because there is a bit of a dancer phenomena. We don't want to talk about the pain that we're having because it affects potentially our work. So I think it's really important to be able to come together as a group, have a dialogue, and talk about how we can improve our workplace so that we can actually work longer and serve our patients better. I just want to acknowledge the COS and the COC and JCAPO for supporting our survey. Thank you.